Yeah, there's a lot of fear around exercising during pregnancy, and there's actually a lot of misinformation that when you're pregnant you need to stop. But there's so much evidence, so much research now on the overwhelming benefits for mum and baby, exercising during pregnancy. So you take the American College of Sports Medicine. That's like the gold standard of exercise.
Williams, and welcome to another podcast on physique transformation, the podcast that connects like-minded, passionate individuals who have shared the same message, and that is to help you transform your life. On today's podcast, we have a special guest, Rhian Adams, who is from Wales in the UK, my hometown. She is a competitive fitness athlete with over 10 years experience. She has represented Wales and now is flying the flag, living in Dubai too. She won PT of the Year in Dubai in 2018 and 2020. She pushed her way to the top of the fitness industry, her career, as well as many mountain peaks on her adventure treks. Rhian is a role model to many women and men that inspire to be great. She's a tutor at Body Act, which is one of the leading fitness and educational providers in the UAE. She specializes in pre and post-natal training, helping mums improve the way they look and feel during these challenging times. She is certified doula, which is a non-medical assistant in childbirth. She is passionate about helping mums stay fit and healthy through pregnancy, as well as maintain that afterwards. Her biggest success comes from giving birth to two beautiful children, a little girl, Sarah, and a little boy, Samson. And now we have Rhian on the podcast to spread her passion, advice to those who want to start a family. So, Rhian, welcome to the show.
Wow, what an introduction. Thank you so much.
Yes,
possibly the best introduction I've ever had. Thank you.
Oh, wow. So, yeah, like I said, it's been a long time really. We've had a kind of few catches up here and there, but we're from the same place in South Wales. And, I've watched your progression over the years. And like I said, it's inspiring to see. So it's a pleasure to have you on. Thank you very much.
Thank you.
So
looking forward to it.
I've put a few questions together. So today we have a very special podcast. We're going to talk about training for pregnancy, which can be considered a bit of a taboo to some people, but we both know that training for any event in particular needs preparation. And as the saying goes, you either fail to prepare if you don't prepare to fail. So the first question I have for you is, how are the children? How's the little boy and the little girl?
They're doing really well, thanks. My little girl is in school and my little boy is in the other room, so hopefully he'll keep quiet.
So we have to keep it down, and maybe I'll come a little bit further back.
No, it's fine. It's fine.
And how is Samson now?
His health is much better. We haven't had any hospital stays in the last 2 months, which is great because we've had 6 hospital stays in the first 6 months of the year. So yeah, God willing, it will all be fine.
Bless you all. And like you said, pregnancy, giving birth.
Yeah.
I can only imagine because everybody's on their own path. And, I've been following, obviously, your trials, tribulations, your ups and your downs, your successes and everything. And like I said, you conduct yourself in a very professional and authentic way as well, which is, I think, why you stay so relevant to so many people. So keep doing what you're doing because it's definitely inspiring.
Oh, thank you. It's very important to me to be authentic and vulnerable and to just show the real me. Yeah, so thank you.
Okay, so first question I have for you, apart from obviously catching up and how your family is, obviously, your body changes dramatically, your life changes dramatically, when you're pregnant after you have a child. So what were some of the changes that you experienced with your body that you either did not prepare for or expect during pregnancy of your first child?
Did not prepare for or expect. Well, to start with, I didn't expect to be pregnant. So that came as a shock, which took me probably 2 or 3 months to come around to. I was training for the summit of Everest, spent a lot of time in Nepal, climbing the Nepalese mountains, ice axe climbing in Scotland, and then I found out I was pregnant. So this was a big shock. I did not expect. Yeah, in terms of how my body changed, I think if you are in the fitness industry, it's a little bit more of a challenge because you're used to being in shape, right? So the first trimester is all great. Second trimester, your breasts and your bumps start increasing in size and weight. You start experiencing aches and pains in your body that you've never experienced before. Thankfully, I didn't get morning sickness or nausea. And every trimester, I think for every woman brings its own share of struggles and experiences. And I feel like every woman's journey is different. Probably the first time experiencing back pain in my life, because of course, you know, how the posture changes, the rounded shoulders, a little bit more lordotic in the lower back. So your lower back is taking a lot of strain, trying to compensate for this big bump. And training had to change a lot as well. So I'm sure we'll delve more into that on how the training changes through the trimesters. But I was surprised by how much my body was capable of during pregnancy, even though I've been pre and postnatal trained way before having children. I was surprised at how much I was still capable of, and being able to exercise, do strength training, still be able to do cardiovascular training. You kind of feel like Superwoman. So yeah, it's an amazing journey, a very special journey actually, which is it's a beautiful thing for me to be part of other people's pregnancy journey, you know, in the job that I'm doing now.
Yeah, I mean, you know, sometimes I give you a quick example. It's nothing, you know, related to what you're talking about. But I've helped many people out with intermittent fasting and fasting through Ramadan, especially in the UAE. But the year before last, I decided to fast for Ramadan, you know, and went through the same procedure up until 7 p.m. And there were certain things I learned from the experience that I did not know from my education, you know, and I just didn't expect these things. So I guess even being certified in the field, I mean, going through the same struggles, I guess, changes and challenges that other people feel, you can modify your approach that's more suitable from your experience as well. So that is great. So you know, you did these big treks. So you were up in the mountain, you know, wherever you decided to do these treks, and then you realized you were pregnant. Would you have still did these treks if you found out you was pregnant beforehand?
So at week 9 of my pregnancy, I went to Scotland for a week and I did ice axe climbing with crampons on. It was something I was used to, which is why I decided to still go. You know, there was modifications like, you know, the harness, I would make sure it wasn't too tight around, you know, my bump that wasn't quite there yet. A little bit more mindful of my intensity, keeping it a moderate intensity. And listening to my body, being very bodily aware, because, you know, I mean, being up there nervous, there's a little bit of altitude up there nervous as well. So obviously mindful of that, but yeah.
Yeah, and one of the reasons why I ask, because I know a lot of people, especially like men and women, obviously, women get pregnant, and if all things are good, there's usually a loving partner who's there and supportive and so forth. But the concern is usually on doing anything regarding lifting that might potentially cause a risk, you know. So a lot of people avoid this kind of topic altogether, you know. So what would you say, how important is exercise during pregnancy? You know, what is the best form of exercise?
Yeah, there's a lot of fear around exercising during pregnancy, and there's actually a lot of misinformation that, you know, when you're pregnant you need to stop. But there's so much evidence, so much research now on the overwhelming benefits for mum and baby, you know, exercising during pregnancy. So, you know, you take the American College of Sports Medicine, that's, you know, like the gold standard of exercise recommendations. You know, they recommend, even if you haven't exercised before, to participate in cardiovascular and resistance training throughout your pregnancy. And, you know, this is medical professionals. This is based on the latest research, you know, showing that exercising during pregnancy is so much more beneficial than not exercising during pregnancy. And there's so many benefits, I mean, that I could just, less risk of gestational diabetes, which is actually quite prevalent here in the UAE. And I guess the stats are 1 in 3. So when you're pregnant, your body, the way your body responds to insulin is different, or it responds to glucose is different. You become more insulin resistant. So, your uptake of glucose into the cells is affected. So you've got higher glucose in the blood. Exercise makes you more insulin sensitive, right? So you're reducing that risk of gestational diabetes. You're reducing the risk of unnecessary weight gain. So, of course, we need to gain maternal fat to support the baby, but less unnecessary weight gain, which is also going to help us, I don't want to say bounce back, but return to our desired shape after having the baby. Less aches and pains. So the more we move, the more mobile our joints are going to be, the stronger our muscles are going to stay that would otherwise weaken, which means less aches and pains. Lowering the risk of back pain, which is very common. We've got staying strong for motherhood. Motherhood, oh my gosh, so much. The physical demands of motherhood and all the bending and lifting, you want to be prepared for it. Like 9 months off is a long time for anyone to kind of come back from. So it's important that we stay functionally fit, incorporate simple exercises like hip hinges and kneel to stand and suitcase carry, farmer's walk, and just be ready for the motherhood journey. Having a strong posture. So, the breasts and the bump are increasing in size and weight. So your posture starts to change. But resistance training is going to help you maintain good posture throughout. It's going to help you be more mindful of that waddle that starts coming in the 3rd trimester, bending down and picking things up properly with good technique, and especially keeping the posterior chain strong and the core. Again, resistance training is so crucial. Resistance training, again, we're preserving that muscle tissue, right? So pre-pregnancy, again, our muscle tissue is our engine. So we're going to get back to our desired shape a lot faster because we are burning calories a lot quicker than if we lost that muscle tissue. If we don't use our muscles, we're gonna lose that muscle tissue. And then what else? There's so many. Easier labor and delivery. So like you said in the beginning, some would term it the biggest athletic event you'll ever experience. And those labors can be long. They can be exhausting. So you think of the benefits training gives anyone: higher pain threshold, greater endurance, greater stamina. That, along with being stronger around the birth canal, having better pelvic floor health, being able to, relax your pelvic floor as well to help the baby pass through without tearing or, without episiotomy. So less interventions, actually, less pain relief, less interventions, and quicker and easier labor. I mean, more chance of a quicker and easier labor. It's not to say, it's not going to be difficult. Less chance of C-section doesn't mean you may not have one, but research does show that it does reduce the risk of, needing interventions like cesarean sections. So, yeah, there's a lot, right? There's a lot.
Brilliant. It's brilliant.
Cardiovascular, increasing your circulation during pregnancy. So that's obviously going to help deliver nutrients to the baby, but it's also going to help, things like swelling in the legs, cramping, varicose veins. It's just going to really help you feel good in your body. Those endorphin releases, so you feel like a fit pregnant mama, instead of like, a big beach whale, which some days when I didn't exercise, that's how I'd feel. I'd feel, heavy, stiff, lots of aches and pains. And the recommended amount of exercise, according to ACSM or AC, American College of Obstetricians and Gynecology, is 150 minutes per week, which is about 5 times 30 minutes of exercise. And only 25% of pregnant women actually get that recommended amount of exercise at the moment. So that's one of the reasons why I'm so passionate about this field. And I love helping women stay fit and healthy, because it's life-changing. It's a game changer. So yeah. When
Yeah,
I
I mean,
got
it's brilliant.
pregnant, yeah, when I got pregnant, I found out quite early. Generally, you find out around, maybe between weeks 5 and 8. I went to the doctor for the first scan. Everything was great. She said, okay, so it's time to stop everything now except walking and swimming. And of course, she didn't know I was a pre and postnatal trainer. Whether I was or whether I wasn't, it was just a shock to hear that,
Yes.
there is a lot of fear around exercise during pregnancy. And, there was no reason for me not to continue. So, if people are ever in that situation, I would maybe think about changing doctors, which I did, and she approved of exercising. But of course, have a health evaluation first, just in case there are any, complications, or, you have hypertension and things like that. So you do want that doctor's go ahead first. Yeah.
It's brilliant. It's like essential, it's essential for pregnancy. Like you were saying, it's one of the biggest, if not the biggest event you can prepare for in your life. And you need that endurance, you need that strength, you need that, mind to muscle connection with certain muscles. You need that endorphin release. There's a lot going on in the body. You got the prolactin levels are going up, which, it's going to retain water and fat. And I was actually listening to a really incredible study. It was talking about energies more than pregnancy, and talking about how like pheromones can get picked up and so forth. And he was saying that in the stages where prolactin levels are so high in the woman when she's pregnant, the male that's closest to her, actually their prolactin levels increase as well. And they start to gain fat because the fat, obviously, our archive system tells us that in the first couple of months, as you were saying, of giving birth is challenging. You don't sleep. So it's like the body starts going to this like hibernation type of mode where it starts storing. So, training is essential, as we just talked about, not just for vanity purposes, although that can be good for self-esteem, but for the deliverance. And also, you can correct me if I'm wrong, but the more active you are and the more physically fit you are, the more effective it is to continue the training. Meaning, if you didn't train for 6 months into the pregnancy and then you just started training, that probably would, be a little bit of a risk, I guess. But as you continue, I mean, you can last. So the point I'm trying to get to, if anybody is planning to have a baby, not even is pregnant, but is planning to have a baby, the best thing you can do is start training and continue training, because the whole journey, experience, and the deliverance will be far better.
Definitely. And, get to a healthy weight before conception. But even if you've never trained before, it's still a great time to start. Like, you can start, first of all, when you get pregnant, you want to think about starting pelvic floor exercises. Then walking and swimming are exercises you can do without supervision. There's lots of prenatal classes where you're in a safe and supportive environment, where the instructor is qualified. And you can also meet a lot of other mums. You have a social aspect of women are also going through, the same kind of journey and also giving birth around the same time. But yeah, in terms of, mobility that can be done at home, the wrists, feet, mid back and hips, like they are some main areas to focus on for, to mobilize during pregnancy that get really stiff. And then resistance training, which I would recommend a prenatal qualified trainer to guide you and just help modify and adapt as you go through the trimesters, because every woman's pregnancy is different. And, one woman may be able to jog through her pregnancy up until the day before she gives birth. Or someone like myself stopped around week 18 because he wasn't comfortable anymore, Some people can plank through the whole of the trimesters. But then generally the advice would be to stop around week 12, end of the first trimester, because of the abdominal pressure that's created that can, encourage the abdominals to separate even more. So, but yeah, on the note you said about the husbands putting on weight, it's the first time I've seen my husband Ollie with love handles, which was during my pregnancy.
Crazy, right?
Isn't that? Yeah, wow.
It's brilliant though.
And
It's just a. I mean, it's brilliant to see parents because, especially like yourself, you and Ollie, you're very, fitness is a big part of your lifestyle. Of course, the way you look, your body is not only, taking you to the top of different peaks, but you've built a career from it. So there's a lot of
yeah,
physical and psychological kind of, changes that go in place, and having each other and seeing each other go through that is what one of the other questions I have for you is, look, I've been with my wife for 13 years, right? And she's my best friend and I know her better than anybody. But honestly, and I'm going to tiptoe on this kind of next question is when when the hormones are spiking, I don't know what the hell to do. Sometimes it's usually do nothing and just smile and nod and listen.
yeah.
That usually works for everything. Whatever the problem is, just acknowledgement, smile and listen. And my maid's going, I have no clue of why she is upset or whatever. But she's amazing just to get out there. But also, you know, what advice would you give, being, postnatal and prenatal kind of advisor, and obviously being a woman who's had two children and gone through pregnancy twice? What advice would you give someone like me who is potentially a father to be? What can I do to best support my woman in this journey?
Well, leave the house when she's very hormonal. One thing I would say is during pregnancy and postpartum, it was a time where I realized, you know what? We are on different planets. Men and women, we're on different planets. You notice the difference in the sex, yeah, when you go through this journey. What advice would I give? I guess help support you emotionally. It's encourage you to exercise, because we all know exercise lowers stress levels, is so good for our mental health, increases confidence. It gives her that me time. So she kind of feels like her old self, even though she's pregnant. So I definitely feel like a lot of women need to get their husband on board. To encourage them to go out and, and do things like that. I remember during my pregnancy, during a very hormonal moment, I felt really lonely. And the problem is during the first 12 weeks, you can't tell anyone, right? So no one really understands what you're going through. And he says, you need to build a support net. I said, I haven't got any friends that've got babies, because all my friends are in the fitness industry, and they're very focused on their fitness career. And he was like, well, you need to go out and build a support network. I was like, okay. And that's what I did. I built classes, pregnant classes, baby and me classes, and I built this support network around me. Go to prenatal classes, join prenatal groups. In the UAE, there's always like a group of, if you do between July and October, you join the Facebook group, you join the WhatsApp group, but you've got that support network there. And I think being in Dubai, that would be, definitely something that she needs to do, because we haven't got family around us, right? And the husband can't give us everything. So yeah, I think that would be my biggest tip. And I think in terms of mood swings, nutrition is important. So during pregnancy, when we get a lot of cravings, and if we do eat too much refined carbohydrates, then our blood sugar is going to be up and down, which really, it doesn't help our mood swings, right? So keeping the blood sugar balanced.
Yeah, the insulin sensitivity.
Yeah, insulin sensitive. Keeping the hormones balanced with training, and thinking about what she needs to take care of herself. Asking her what you feel will help. Maybe it'd be a prenatal massage. Yeah.
Yeah, I mean,
what I found, which is good actually, because you've got a French bulldog, right?
Yeah, I have, yeah. But he might be buried in the garden soon if he keeps up. Be buried in the
walking the dog in the mornings really is to help me just get, clear my head, get my mindset right. It's really, with all your hormones are completely out of whack.
I can only imagine what it's going to, honestly, because look, the way I look at it, this is why I got so much, inspiration I get, and from women who give birth, because you go through a lot, like you go through a
Yeah.
lot. That's why only now, probably in the last like 5 years, I've got so much respect for my mum. Like, not that I never used to, but I just got a lot more. It's like, first of all, you went through a trauma. It's a trauma. The body changes. You're crying for no reason, and you don't even know why. And then, and so any husband or any partner, to see that woman willingly doing that as well, that has to be so inspiring. And it's tough on the guy as well. Like you said, the guy's got the pressures of the work, and not that the women don't, of course, but if the woman's taking time off, it's a teamwork. The guy's working hard, and although he wants to be around the child, so it's teamwork, I guess. And I guess as long as you stay united together in this together,
Yeah.
I think that'll get
And
you through
to
anything.
remember, I think, is that it's temporary. The little hardships are temporary and they will pass. And we're not alone. Like, there's women and men all over the globe experiencing the same kind of struggles. I know that doesn't help in a way, but just knowing that you're not alone, I think it really helps. So I think,
Yes. Go on, sorry.
yeah, I think your wife, she's in the fitness industry as well, right?
Yes.
Yeah. So, I guess being in the fitness industry, we learn to love and respect and appreciate our bodies anyway. And I think when we do that through different stages of life, like pregnancy and postpartum, I think that's when we treat it better and we care about how we feel, what we feed our bodies, making sure that we move enough. And that's when we really start caring about our bodies, is then, is when we start loving and appreciating ourselves in our weaknesses, in our imperfections, in its abilities. So
Brilliant.
embracing it. Yeah.
And we had a quick conversation off camera, and we were saying about the importance of staying authentic and genuine and being relatable. I believe that was off camera, but anyway, it goes to the point of there's two things that sharing does. Sharing experience, obviously it helps you because it releases any tension, and you realize there's more people like you, but also it helps so many people as well. And that gives you so much gratification of knowing that your path is leading the way for other people. It's so important for me anyway, is in terms of my personal purpose and drive in life. So sharing is caring, right?
Absolutely. But even though, like, we mention all these hardships and the struggles, I hope I haven't turned anyone off.
Probably.
I loved being pregnant. It's such a special stage of your life where you have, a human growing inside of you. It's a miracle, right? If you think about it.
It's a miracle.
Yeah, the baby's brain and the eyes developing, the central nervous system. It's miraculous. And I think even bearing that in mind can make the journey a lot different for you. It's perspective, I guess, right? But also remembering that in our postpartum stages, when that brings its own challenges and struggles, is remembering the amazing miracle our body has just performed,
and that you were once or still are that same miracle. And that's a very important factor as you go in through your journey and you see in that life form develop. It's like, and again, we go back to that appreciation. And like I said about for my mother, wow, imagine having a child and what, like you're doing now, you're watching your children grow up and you're there, and all through the struggles and the successes. It's just a gift and it's a miracle. So I'm going to actually, my wife's not pregnant, by the way, so anybody's who watches this and be like, "Oh, congratulations!" But it'll happen soon, because we're at that time in our lives. So as soon as my wife falls pregnant, I'm starting writing a book. So I'm going to say this now on camera, right? Because the book I'm going to write, and I'm going to document my experience as a husband, okay, with things I have no idea about, but I'll learn and I'll adapt and I'll find my way, and I'll put it into the book, and it's going to be called Becoming an Amazing Father. And that's the title of the book. So
Oh,
there you have it.
wow.
Very good.
Yeah, amazing. Well, I listened to your last podcast that you just released, which was amazing, by the way. And you mentioned that you were looking to have a son in the next 5 years, right?
Yeah.
So
I was thinking about
good.
our business is expanding, so I thought the more children we have, the more work can be done. No, but
Very
yeah,
exciting.
definitely. So I have one last question for you, okay? Obviously this is a transformation kind of podcast, and yourself, myself, even talking about this topic now, we're talking about your body's going to transform, your life is going to transform. What advice would you give anybody that wants to transform their life?
From motherhood, from
Anything, business, fitness, body,
okay,
motherhood.
okay. For me, it all starts with a spider diagram. Get a pen and paper out and just have a think about different aspects of your life. So, your nutrition, your exercise, your spiritual life, your social life, your marriage, your hobbies. What have I missed? Yeah. Have a look at all different aspects of your life or your work, your career, your finance, and have a little look. Make it simple, give yourself marks out of 10. Um, and have a think about each one, spend time on each one, and think about how is there any areas you want to improve and develop to be your best self. Because basically that's what we're all wanting to do, right? Is growing to become our best self. So I think what we don't do often enough is reflecting. And I think for me, the last 8 months being in hospital, so much, 28 days in ICU and being in isolation. So you're not even allowed to leave the ward. I spend a lot of time journaling and reflecting on different areas of my life and, thinking about, okay, how do I want to get better in this particular area?
What
Start with the
area was
spider
that?
diagram.
What area was that, Rhian?
Did I want to
You said
all of them?
okay, you're looking at, yeah, it's very important what you're saying there, because I guess there's one thing transforming one area of life, but then usually, because we all get the same amount of time, right? Depending on how we use it. So there's always sacrifices to be made when we want to. It's like to let go of the branch we're holding and get to the next. We have to let go of it. We can't hold on to both branches. So that is important, because it is what you want to transform to, or the goal you're pursuing. Is that going to jeopardize other areas of your life? But I want to ask you this, and again, anything you don't want to discuss. What was that time like for you?
It was very tough, very challenging, but it was a time where I felt a lot of peace. And that's, contradicting in a way, but I felt a lot of peace. And after it, I felt a lot of freedom. And I think the whole traumatic time of, my son being in hospital with pneumonia, RSV virus, sepsis, deep vein thrombosis, fungal infection in his blood, being on 80% oxygen, like it was horrific. But I think it overwhelmed me so much that all I could do was pray, trust that it would be okay, and have peace in my heart. And it was life changing. And I think after all that, I came out of hospital with such a different perspective. A lot of things that I thought mattered didn't. And, I just felt a lot more free. My priorities were quite simple. A lot of the day I had to lie in bed with my son. Even at home, when we came home, I had so many things that needed to be done, the washing, showering, eating, that I had to just stay there with him. And it taught me to filter things out, get rid of distractions, and be in the present moment. Yeah, so I think that was the key. Yeah, I think that's what I took coming out of it, is being in the present moment, trusting when things are going wrong, and it just shifted my priorities. Yeah.
It's a miracle. When you look at it that way, it's another miracle.
Yeah, I mean, we didn't think he was, people, some of the doctors didn't think he was going to make it. It was pretty critical. We went to 5 different hospitals, via ambulance. But yeah, thankfully.
Thank God. And thank you as well
Thank
for
God.
sharing all this.
Yes.
And we send our prayers out as well. I was praying for Samson, and I think collectively everybody was, because the journey was so touching, and I can only imagine, and that's why I like to ask as well, because I love psychology, and I love to understand what went through somebody's mind at the heart of their career, and the depths of their most darkest times, because ultimately, if people get through these times, it's incredible. So Rhian, thank you for your time. I really, really appreciate it.
Thank you so much for having me. It's been great. Thank you.
Thank you. It's been a pleasure. It's been many, many years, and we've had to. It's funny. We live both living in Dubai, and we still doing this over Zoom. It's brilliant. It's like the world we live in, right? It's incredible.
Social distancing, yeah.
All right. Thank you once again. We're going to put all your links below to obviously all your social media and everything else. So if anybody wants to reach out to you for advice on postnatal or anything else, any fathers, to be, what's your advice?
Yeah.
But thank you very much. Well,
thank you, Christian. Have a great day. Bye.
Thank you. And thank you all once again for another episode of CW Physique Transformation. If you haven't done yet, subscribe to this channel, comment below, share this video, and stay tuned for more to come. Thank you.